See, look at this picture. This picture nicely explains the formation of the tympanic membrane. See, this is the first pharyngeal arch. Here is the cleft, and here is the pouch. Pouch is given in yellow color because it is lined by endoderm. The cleft is given by blue color because it is lined by ectoderm. Between these two there is mesenchyme, that is mesoderm is there. So between these two only you have the tympanic membrane formation. So the tympanic membrane developmentally it is lined by all the three derm layers, tridermal in origin, outer ectoderm and inner endoderm and middle mesoderm. So in gross anatomy, when you explain, you have to explain as outer cuticular and middle fibrous and the inner mucous layer. This is how you have to explain the tympanic membrane. So this is very important for the tympanic membrane. And here you could see the fistula. Look at this. This is how the fistula arises. Cervical sinus, I said in the first previous video. The cervical cyst will be formed. If the cyst remains and if it ruptures, look at this, it is going outside, one way communication, that is called as cervical sinus or branchial sinus. So look at this, this is a pharynx, pharyngeal cavity inside, and now what happens, two-way communication. It is communicated inside the palatine tonsil. So two-way, outside also, inside also, between the branches of the common carotid artery. So it is the commonest site, right? So here both the sides it is communicated, that's why it is called branchial fistula. It is usually anterior to the sternocleidomastoid. Look at this hyoid bone, just above the hyoid bone you have the cervical cyst. You can see the opening here. So tympanic membrane, very important embryology MCQ, and this fistula also you should not forget to write. Another one clinical anatomy for the pharyngeal pouches is, look at this baby. This area, because of the failure of migration of the neural crest cells, this arch is not being formed properly. So look at this, note the deformities of the external ear, preauricular appendage, defect in the cheek, everything, hypoplasia of the mandible, macrostomia, everything, large mouth because of this failure of development. This is a very important syndrome, Treacher-Collins syndrome. So hypoplasia of the mandible, mandibulofacial abnormalities.